Good afternoon, everyone. Can you hear me okay? Excellent. Everybody learning lots of new fun stuff? Excellent. Hopefully we'll get some good information out of this presentation as we go through. So what we're going to do is we're going to go through Adventist Health System's journey with unified communications. It's just the beginning, so hopefully as we go through the slide deck, you'll see some of our challenges and how we are where we are today with the deployment of Lync and the integrations with other systems. So my name is Mark Dunkerley. I'm the team lead for messaging services team at Adventist Health System. The services that we manage as part of the messaging team is the email services, email archiving, mobility. We manage our BYOD platform along with all the collaboration, which includes all the Lync, IM presence, web conferencing, the video, and all that fun stuff, which we'll go through during the presentation. So as we go through the presentation, we'll give a little introduction to who we are. We'll talk a little bit about unified communications at Adventist Health System. We'll touch on, where we were before Lync, our current deployment. We'll give you a quick review of our current deployment, what integrations we're looking at as an organization. We'll go through some current initiatives, some future initiatives. We'll touch on mobility a little bit, and then we'll just finish off with some closing statements, and then any additional questions at the end. If you do have any questions at any time, I'll be happy to take those. If it's a question that's turning more into a conversation, I'll probably take it offline because I have a lot of content. So if it's a simple question, I'll be happy to answer it. But if anything that's going to take a discussion, I'll simply take it offline and we can discuss it after the presentation itself. So who we are. So Adventist Health System is established in 1973. We overlook 45 major facilities throughout the Midwest, the eastern states, approximately 70,000 employees. We serve 4.5 million patients annually throughout the year. We're actually headquartered in Orlando, Florida. And then we have AHS Information Services. So just to give you a real quick high-level overview of our organization, Adventist Health System has 3 IS divisions. Adventist Health System Information Services is the division that I work for. We also have a Florida Hospital Information Services group, which manages the metropolitan facilities within Orlando itself. And then we also have a Adventist Care Center, which is our long-term care health. We have a small IT division that manages that. So as we go through the presentation, my presentation will be geared more towards the AHS Information Services department, which I work for. So with AHS IS, we actually have 700 employees in our IS group. We manage facilities over 9 different states. We have approximately 32,000 employees, and we manage about 32 major facilities throughout the states. So if we look at unified communications, it's a buzz term right now. It's been around a while, but it's getting to a place as, how do we work with unified communications? How do we grow with it? So I found Gartner's definition, which I wanted to include. Gartner defines unified communications products as those that facilitate the interactive use of multiple enterprise communications methods. This can include control, management, and integration of these methods. Unified communication products integrate communication channels, networks, and systems, as well as IT business applications, and in some cases, consumer applications and devices. The words I actually highlighted as some of the key points, I think, as we move forward with unified communications. The interactive. How do we interact with all the tool sets that we have? Those multiple enterprise communications, we have several different tools now that can do the same thing, and how do we interact with all those tools? The biggest key word in here for me is the integration. How do we integrate those communications, especially large environments that have big investments in other areas? So the integration, I think, is going to be key as we move forward with unified communications. And then obviously the business applications and the consumer applications devices that we need to use those integrations and the tools themselves. So with that, I put together a slide on the different verticals of unified communications. So if we look, we have IM and presence. That's our chat and availability. We go through to our web conferencing, which is our collaboration, our data sharing, bringing in the dial-in conferencing within that web conferencing. We also have our messaging vertical. That's all our email, voicemail, fax, SMS. And then we have our voice, moving from traditional into a VoIP environment. We also have video conferencing rooms. And then we look at all the clients and how do we access all these different verticals to communicate. I also added in a different vertical, which, in my opinion, actually covers all the verticals within unified communication, and that's the mobility. Mobility is grown out of control right now, and it's something that needs to be identified, in my opinion, as part of unified communications. We need to understand it, and as we grow with it, it actually falls in all these disciplines, in my opinion. So mobility is a big one, and something that we need to sort of understand as we grow with unified communications. So before unified communications at Adventist Health System, so I'm guessing most of you might be in the same situation that we were maybe about a year ago. As you look at all the different verticals, from the messaging to the voice to the AV, we were in a situation where we had, myself working in the messaging services team. We managed IM presence, web conferencing, email, video, mobility, and we report to a manager who report to a director. But then we had our voice services, our video, fax, voicemail, doing their own initiatives, reporting to a different manager, also reporting to a different director. And then we also had our AV, our video conference rooms, who also had a manager reporting to a different director. Those of you who are familiar, maybe in this situation, know that, as you drive forward with unified communications, you're not going to really have a true unified communications platform. You're going to have initiatives driving in different directions. You're going to have directors who want to create their own initiatives, and it's going to create some form of conflict and probably user frustration as you move forward with unified communications. So what we did as an organization is we identified this. We looked at the different entities within unified communications, and we bridged those teams together. We still have the 3 separate teams right now, but we have the 3 separate teams. A position was created, a senior manager of unified communications, and we also now have one director that all these 3 teams now report to. So essentially what this is going to do, it's going to allow us to drive forward, drive our initiatives, and bring together those teams to create a more unified platform, which is essentially the end goal as we move forward with unified communications. So with that, as we move forward with one team now, which is actually very exciting for me now that we can start working together as teams instead of creating duplicate technologies to do the same thing. As we move forward, initiatives can now be driven in the same direction. This is huge. This is going to help a lot. We can also potentially see some cost savings. Our voice team was setting up the Jabba environment, it's IM presence. Why do we need that if we already have Lync? So maybe we can have some cost savings in regard to licensing and those sort of things. It brings everybody on the same page. One leader makes a big difference. We have one direction coming from one person, so now we can start moving forward more efficiently with the technology. A more integrated solution. Being able to provide ease of use solution as we look at unified communications is key to this, is making sure the users are able to adopt it and it's easy to use. Better user experience, like I just mentioned, and as we move forward with unified communications, we have those 3 separate teams. I sort of foresee some cross-training, and essentially we could probably just see one unified communications team and sort of the technicians being able to manage all those different technologies within unified communications. This will also help as we move forward, drive those initiatives and integrations a lot more efficiently as we do move forward. So before Lync, you might be familiar with most of the logos on the screen. So in about 2008, we started seeing an adoption of the consumer-based products within the environment. Yahoo, Live Messenger, all the different products up there. Being healthcare, we have some pretty strict compliances in place. We're going to make sure we protect our data, make sure that the data is not leaking outside our 4 walls into the hands that it shouldn't be. So there was 2 things happened. Number one, obviously there was a need for the communication with IM and presence. So the users are starting to use it for business, obviously personal. So there was identified that there's a need, and we need to make sure we can still provide that need to the users, but how can we do it securely? How can we actually manage and take control of what the users are doing? So with that, it was identified in 2008, it was OCS 2007, and we deployed our first generation of enterprise IM and presence with OCS 2007. This was a limited deployment of approximately 1,500 users, and it was scoped to IM presence only, but it allowed us to turn off access to all those consumer-based products within the environment and start driving those users in a more managed environment that we could actually monitor and make sure that information is contained within our environment. As we started growing with OCS, we migrated to 2007 R2. It was a small migration, Nothing really changed with that. That was in 2009, and then the biggest change came along in 2011 when we migrated to Lync 2010. The time we also migrated to Lync 2010, we had a change in the licensing structure, so we went to the standard CAL, the enterprise CAL, which allowed us to start adopting more IAM presence within the environment. So as we moved to 2010, we were able to start deploying IAM presence to all users in the environment. If a user had a standard CAL, they get a mailbox, but they also get IAM presence with that. So there was a big adoption with IAM presence in 2010. We also migrated, we were using a Bell South conferencing solution. It was being end-of-lifed by AT&T, and with that end-of-life, we identified Lync 2010 as also a replacement for the web conferencing. We did supplement it with a separate third-party dial-in conferencing, but we did replace the actual visual portion of web conferencing for collaboration for our Lync 2010 users. We also started doing some audio-video at small levels, testing it and doing some different case studies. Obviously, 2010 was the first generation of Lync mobility, so we did enable that, tested it. It was pretty limited on the web conferencing side, but we were able to get the basic IAM and presence features. So we started getting some adoption of that. And our dial-in test, like I said, we're using a third-party service, but we did integrate, and we do have integrations with the dial-in test into our web conferencing with Lync. And we'll talk a little bit more about that as we get into the integration section on how we're doing that right now. And then eventually, last year, we identified some significant improvements with Lync 2013. So we had a big push to get to our 2013 environment. Again, IAM presence for all users. As we did the migration, it was approximately 52,000 users that we got migrated to 2013. Web conferencing, we're still doing that audio, video. We have now enabled mobility for all users. That was one of the huge improvements of 2013 was the mobility that it offered. Dial-in slowly being rolled out, and then we're also doing some forms of voice enterprise and some testing, which we'll go into a bit more detail as we go through the presentation. So with that, I just wanted to include a quick slide on our migration from 2010 to 2013. I don't know how many of you are on 2013 right now? Do we have a good, okay, so you probably went through the same process. You set up your 2013 environment side by side, get everything working, then you can slowly move over a test set of users, make sure everything's working. Once everything's validated, then you can start doing your bulk migration. The great thing with this migration is we deployed 52,000 users and they didn't even know about it. So that was a great thing. The 2010 client is compatible still, so we were able to leverage that still and get everybody on the back end to 2013. So we're fully deployed on the back end to 2013 right now. So some of the reasons for Lync 2013, there's a lot more reasons what I have listed here, but these are some of the highlights that we looked at to actually make this push to 2013 to help us grow the environment and get it adopted more. The client, the client could be used in 2010, but some of those features wouldn't be available without 2013 on the back end. But a new improved client, tab conversations, this is a huge one. We're getting a lot of requests on how to do tab conversations. There was some third-party tools in 2010, but now it's actually integrated, so it's a really nice little feature. Gallery view for video. Now we don't just have the active speaker, we have up to 5 participants within the gallery view for streaming video. Integrated persistent chat. We were getting a lot of requests for persistent chat in 2010, but we held back on it because of the complexity in the environment and the separate clients to have to manage that. So we pushed off, but now with 2013, we have that integration with the persistent chat. High resolution photos. Those of you who are using photos in Active Directory probably see the quality is not too great when Lync likes to change the photo to a full screen. So we'll be able to start working with the high resolution photos as we get into our Exchange 2013 deployment as we get further down the road. The presenting status, this is a huge one. I don't know how many of you out there at some point have done a presentation and got a pop-up window in the middle of an important meeting saying, what time do you want to meet for happy hour? It can be pretty embarrassing. So the presenting status is actually a really cool feature that once you present, or Lync identifies you presenting and puts you into a presenting status, which doesn't allow anybody to do the IAM presence. So that was a real great feature that we've seen. And then as we move through to the Lync web app, those of you who managed external participants in 2010 probably felt some of the pain that I felt trying to support an attendee client along with a web app which didn't support all the features for audio, video conferencing. So now that we have a one client for external access, and it supports all those collaboration features, it was a huge benefit for us. With that, it leverages HTML5 with a plugin, and as we grow with HTML5, we're going to see a lot more features, I believe, integrated with the product as well. Improved video. Microsoft went from the RT video to H.264. It's been adopted a lot more now by a lot of the vendors. This is a huge upgrade, scalable video coding, the ability for a video stream to dynamically upgrade or downgrade instead of having to send out new streams when the quality of that connection isn't there anymore. So that's definitely a huge addition, and along with that is the high definition of 1080p. This is going to allow for a lot more opportunities, healthcare field especially, with being able to provide that to the physicians, to the nurses and the doctors and so forth. And then we look at federation. Skype's one of the big conversations right now. Audio is available, but video still in the works. I think as we see video with Skype being enabled in the next few months, hopefully we'll have a whole lot more of opportunities, and I'll cover some of those as we go through the presentation as well. And then XMPP. XMPP was a feature within 2010, but it was a separate setup. It was a little complex. That was something else we held off with, but now we're going to actually be doing that integration since it's part of the 2013 migration of portfolio. Then we had some improved disaster recovery, high availability, less dependency on SQL. With the presence, we had in 2010 we had some latency between our storage and our database and front-end services. And those of you who have noticed, if you lose connection to your back-end database within 2010, you'll all of a sudden lose all your contacts and the presence for those users, and you get a big red or yellow bar saying network connectivity issues. 2013 have improved on this. They've took a lot of the burden on the database, and now it's in the front end. So that latency between the database and front end can happen without the user even knowing about it at times. So that was a huge improvement. SQL mirroring, pool pairing, another one for disaster recovery and high availability. And then we have the Office Web App. Office Web App isn't part of the Lync 2013 deployment. It's a separate deployment, but the Office Web App allows us, it's actually needed if you're doing web conferencing to do the PowerPoint presentation. It's basically going to allow a lot more compatibility for devices. With 2010, there was I believe the Outlook presentation was relying on Silverlight, so there wasn't as a big adoption into the other platforms that was able to support it. Now with the Office Web App being web-based, there's a lot more flexibility on the devices that can support PowerPoint presentations. And then we looked at server authentication with the Exchange and SharePoint 2013 platforms. We're seeing a lot more trust on the back end between the platforms. It's going to allow a lot more integrations. A couple of them being archiving into Exchange. Now we have one place for all our e-discovery, from IM Presence to email, along with Unified Contact Store. Right now we have two separate places for our contacts in Lync, in Outlook, Exchange. Moving forward, we're going to be able to integrate that into one place as we get to Exchange 2013 and Lync 2013 at the same time. And then some additional role changes, monitoring, archiving is co-located now on the front-end servers. Persistent chat as a role. This is being very well adopted right now with our help desk and support technicians. And then mobility. There's a little joke at work that how many times I say mobility, because I like to stress so much how important the mobility is right now and how much we need to get on top and understand the mobility and the direction it's going, because it's just exploding out of control. So I always tend to, find myself saying mobility without even realizing it, but trying to stress how important it is, for the enterprise as we move forward. In Lync 2013, we had an upgraded client, improved video, audio, and the web conferencing was a big one, especially for our, executives, physicians that traveled a lot. They wanted to be able to partake in these meetings, which wasn't possible in 2010. It's improved significantly with 2013. So I also just wanted to include a slide, on the user deployment as we talk through with technicians, integrators, and we always talk about getting the technology to a level, but we sometimes maybe forget those who actually are the most important, and that's the users coming to the deployment itself. So right now we have a pretty unique environment. We manage 32 sites. Every one of them we look at as different customers. They're all in different areas of the States. So that can be challenging for us to deploy the technology, to make sure that we get it deployed efficiently. So we do have technicians at the sites that we're working with, and they're driving the deployment of Lync 2013 right now to the clients. We use SECM for that in the environment. Documentation, it's important to plan documentation well. Create how-to guides. The example I have here is a how-to guide I created. It's a one-page how-to guide for how to now access using Lync web app for external users. Those of you who've been on the Microsoft site probably see some similarities that Microsoft also have these documents. So I sort of took what they provided and customized it for our users in our environment. So creating simple how-to guides. And then communication. Communication always seems to be after you finish the project and we got the lessons learned is, what can we do better next time? Maybe we can do some communication a little bit better than next time. It always seems to come up, and I don't know why, because it doesn't need to be difficult. Reaching out to the customers can make a big difference. Keeping them informed at all times, and it builds trust and confidence, with the services as you communicate, let them know what's coming. One of the most frustrating things for the users will probably be coming in the next day and finding out that they have a different tool to what they did yesterday and not even knowing about it. So, communication is always going to help you no matter what. On training, setting up classes, the client is different in 2013 than it is to 2010. The collaboration features on different places now, so there is a little bit of a training curve to educate the users on how you now do collaboration. It is a lot better once you figure out where it is, but it's important to let the users know that change has happened. And then just some user feedback. Once we've actually got the users adopting it, they actually, I love the ease of use. That's the big one. Ease of use is what we're looking for our users. The collaboration is great. The client's easy to use and navigate around. And then we'll move into our current deployment right now. So as we move along with Lync 2013, we have approximately 52,000 enabled users. We have our current deployment broke down into 5 different tiers right now, and I got a breakdown of the different licensing. So, our tier 1 is IAM and presence. That's the standard CAL. If a user gets a mailbox, they automatically get provisioned for a Lync account, which is IAM and presence in tier 1. So everybody in the environment has this available. We then move into our enterprise CAL, which is tier 2, and the big step from tier 1 to tier 2 is the web conferencing. I don't know if those of you who have looked at the actual licensing, it was a little challenging to set up because there's not really anywhere well documented on what you can and can't do with an enterprise to a standard CAL. So there was some pretty good blogs I found out there, and we had to go in and once you sort of understand, basically, desktop sharing is more of a collaboration feature, so that starts falling into the enterprise CAL. You got to break it down, and it was a little challenging, but once you understand what the difference between the licenses are, we went in and broke it down, and that's when we went to tier 2, and that's where we added in the web conferencing piece. So the web conferencing is all the collaboration tools, desktop sharing, all those cool things. And then we have our tier 3, which is the addition on top of the web conference. And we do have audio, but this is Lync audio. It's not enterprise voice with the tiers. As you see the audio, you'll see in the tier 5, I'll talk a bit more about the enterprise voice, but the difference between tier 2 and 3 is then the video, so we do lock the video down. Tier 1 and tier 2, our technicians have the ability to provision users to upgrade them to tier 2, but then once we get to tier 3, 4, and 5, we lock this down at a higher level. Tier 3 reason being video, moving to a high definition in Lync. We're looking at essentially a 4 meg stream for one video. We do have in our environment, every one of our facilities has to come back to our site, and they don't get routed out to the internet. We do have in some of our places being remote, as small as 4.5 megs, to some of the sites. Obviously we have, up to 200 and so forth, but, imagine a high definition stream going to that one site, 4.5 megs available, a 4 meg stream. We're basically going to affect, the patient, data being transferred with all the applications. So the video is locked down, but we do promote the use of it. We want to see video being adopted. So as we hear these initiatives, we do work with the users to get them enabled and work with any creative ideas they do have to help them with their workflows and so forth. And then we move into tier 4. Right now we have the dial-in conferencing split out because we still have a mixture of the external conferencing. So we have a policy set up right now where we have our dial-in conferencing enabled for probably a couple of dozen users right now, maybe a bit more, and we're slowly adopting it more and more. Lots of great benefits from the integration with the dial-in conferencing, so we are going to be pushing on that heavily as we move forward. And then we have Tier 5, which falls within the Plus Cal, and the big difference to that is those voice enterprise features and bringing in those into Lync as we move forward. So I just wanted to give a quick sort of high-level overview of where we are, of the usage of Microsoft Lync. You're probably familiar with the screen that you can use within Lync itself. So, as I pulled some reports, we're seeing right now a daily average of 90,000 peer-to-peer IMs. We have approximately 2,000 web conferences weekly, and this has only grown as we grow more with Lync. Dial-in conferencing, it's a limited production, but we're going to be getting this fully deployed throughout the remainder of the year. Mobility, everybody's been enabled, so this is something we're seeing being adopted more and more, and especially with the ease of use of the Lync mobility client and all the features now becoming available. It's slowly being adopted more and more. Enterprise voice, like I mentioned, it's sort of research. We have the integrations going on, but as we slowly move forward, we're going to be looking for some initiatives of allowing the Lync client to use the enterprise voice. Persistent chat, we got this one set up in Lync 2013 since it was a lot easier. The integration was there within the client, and we're starting to see some really great adoption and appreciation from our help desk and support technicians already. And it's only been, a few months since we actually got that set up and working for them, so it's going really well. And then our last one is our federation. We have SIP federation enabled for all users, but we do have lockdown federation. So we probably have about a dozen business clinical partners that we do federation with. That's enabled for the users, but it is available, but we don't allow open federation. We also have public federation enabled, but this is locked down by policy for probably half a dozen people. And this one's going to be big for us, especially with our security office when it comes to Skype federation, is the ability for us to say we have it in a managed environment and only the subset of users are able to use the Skype federation as we do move forward. So we do have that enabled.
What about video?
Video. I didn't include that because I think I ran out of space. The video is, so videos, there's our tier 3, we probably have about 1,000 enabled, and like I mentioned, it's on a need basis right now. We want to promote it, and it is being adopted, but we still got some network considerations before we sort of open it up a lot more. But video-wise, we're probably looking, about 1,000 enabled. We've probably got a sort of couple of hundred definitely adopting it throughout the environment. Yeah, and it's growing more and more, especially with mobility. That's the big piece to it. So I just wanted to give you a quick overview of the topology. We do have a pretty unique environment. Is everybody familiar with the resource forest deployment? So because we have our 3 sites, we have what's called a resource forest. The resource forest is where our Exchange environment, our mobility environment, and our Lync environment lives. In the resource forest, all of our accounts are disabled, but they are then linked through to our user forests, and we have 3 user forests for each of the divisions: Adventist Care Centers, the Florida Hospital IS, and AHSIS. That's where the user account lives, and that's where the user account's active. And then from there, we link it back into the resource forest, which is where Exchange and Lync lives. So this does create some interesting challenges and troubleshooting challenges as we work through the deployment. But essentially, as you see our Lync environment, we do have one Lync deployment, and we have it broke down into sites for each of those divisions. So then I wanted just to include a high-level overview of our current topology with Lync 2013. So as you see, we have our front-end pool. It's still got room for growth right now. We have our Office Web App pool. The Office Web App pool is also being leveraged by the SharePoint team right now. They're using it for the caching aspect in SharePoint, so it's being used by that team. And then as we grow with 2013 and Exchange, we're also able to leverage it for some of those features. We have our file shares. We have our SQL database mirror. We don't actually have our SQL mirror set up fully yet because there was some issues in previous versions that when you would upgrade Lync, it would break that mirror. So we were just waiting for that fix to be put in place, and I believe it is in place. I just need to follow up so I can actually get the SQL mirror set up and working. We also have our persistent chat pool with a separate database hanging off the back. Mediation, so we have our mediation pool. This is where we're doing our integrations with the Cisco and our Tandberg environment, which we'll go into a little bit more discussion. And then as we look, we have our proxy servers. Everything you see is high available. We have 2 of everything at least, high available proxy. We have our edge services, and then we also have presence in OWA of Outlook Web Access. We have 6 client access servers in Exchange. Every one of them provides IAM and presence for the users. And then we also have, it's not deployed, but possibly something in the future, the large conference pool. Right now we're limited to 250 participants per meeting. We haven't really seen anybody go beyond that, but we're getting close to it. So as we grow, we've identified there is options of growing beyond that, and the large conference pool will support up to 1,000 users. This would have to be a physical setup, something that we would have to resource and Exchange and make sure that we manage it and not only one user is using it at a time, but the options there, and it's something we're aware of, and as we move forward, it may be something we have to set up and make available to the users. But as you look at our environment, we have everything's 100% virtualized for 50,000+ users. We haven't seen any issues, and everything's working great. We were the first department to move forward with Server 2012, so we did help with all standards as well, and we've got everything on a Server 2012 right now with our environment. Question? We're VMware right now. Yeah, everything's on VMware. We've looked at it, yeah. We just renewed our Microsoft agreement, and I believe we have the option to use it. So I think, I know Florida Hospital's actually already adopting Hyper-V. They have their Exchange environment fully on Hyper-V and doing some other initiatives. So I think as we move forward and we look at possible, cost savings, I think Hyper-V will probably become a lot more adopted as we move forward. Yes. So I just wanted to include, our Lync 2013 Edge environment. This typically is the hardest part of the deployment, is getting the Edge services set up and getting them set up reliable. Going from 2010, we used a hardware load balancer approach, which was a lot more complex than what 2013 has allowed us. With the 2010 deployment, we basically, with high availability, we'd have 2 servers, but we needed 9 public IP addresses because of the virtual IPs within the hardware load balancer. What this also created was additional hop and additional troubleshooting steps when things weren't working very well. So it was definitely a challenge to troubleshoot this environment when you come from the outside world into a firewall, into a hardware load balancer, into your edge servers, back out to another hardware load balancer, back out to another firewall, and back into your front-end servers. With 2013, we were able to implement the DNS load balancing with private IP addresses using that. So basically the difference between the hardware load balancers, we're using DNS for load balancing. Now we only need the 6 public IPs, and we're eliminating another point of troubleshooting with the hardware load balancers. So this has actually helped us when we actually build the infrastructure as we move forward. So let's move on and some of the integrations that we're looking at. Like I said earlier, I think one of the biggest, with unified communications, in order to be truly successful, I think we're going to have to look at integrating, especially large enterprises. Heavy investments have been made, and we can't simply just go to a CFO and say, hey, that $1 million I spent last year, in my voice environment, I don't need it anymore. That won't go down too well. So we need to look to leverage the current technology, as we move forward, and how do we integrate those, and how do we actually bring in those different environments to provide that true unified communications experience. So just a quick introduction, as we have our 3, for our environment, we had the messaging team, voice team, and AV team, and now we've brought it together to that one team. Integration is needed to provide that true unified communications experience. The reality is you have different vendors for different areas of UC. I can probably right now give you half a dozen that we're using for various different parts of unified communication. Large investments in other areas, like I mentioned, has already been made. Leveraging current investments makes sense. Leverage those investments, but it's going to allow for other opportunities as you create those integrations. It allows for migration paths. So, if we have a current voice platform in place, we do the integration and we want to end of life it or depreciate it over 3 or 4 years, we can at least leverage that, investment, but then we can maybe use it also as a migration path, when that technology comes end of life. And then we have a couple of slides, is the conference room solutions with Lync are just becoming available. I look at the conference room solutions that we're looking at downstairs, the room systems that integrate with Lync, is a sort of change in the AV world from what was traditional voice to VoIP in the telecom world. The ease of use and the cost of these integrations are going to essentially change how we do conferencing moving forward, AV conferencing especially. So these are just basic integrations, which most of you are probably already doing, but with Exchange Server, we're 2010 right now with our Exchange environment. We have 14 Exchange servers, 5 others, that's the proxy servers, backup and management, and so forth. What we're doing right now is we have the integration with our client access servers to provide IM and presence along with email in that one portal. We were able to displace Communicator Web Access eventually last year. It was nice to get rid of that separate tool and that portal and bring it into more of a unified experience for those users that only need IM and presence and mail. So we're doing some integrations with Exchange. Active Directory, obviously you need Active Directory to set up Lync, but we are leveraging Active Directory for our pictures as a central repository for that. SharePoint, we're doing the basic integrations. We're using presence in the document libraries. It's a pretty nice feature that you can go into SharePoint, look to see you actually created or modified the document, then pull up an IM conversation, based on the presence within SharePoint. And then 365, this is going to be big for us. We just signed agreement this year to move to Office 365. This year we're scoped to Exchange only. Rights management services will be a piece of that. I'm going to get it right, the OneDrive will be a part of that. And then obviously the Office web apps available with part of that deployment. So this is going to create a whole lot more of opportunities as we move forward with Office 365. So we're pretty excited about this.
So what was your business reason for doing that?
So as we move forward, if you want to speak, Herb, and give a bit more. So Herb's our CTO. Yeah, it seems to be a trend right now. So next, let's take a look at our integration with voice. So we do have a current voice platform. We're using Cisco as our enterprise voice right now. So as we looked at ways to integrate, and those of you who are maybe in the same situation might be familiar with some of the options to do this integration. As I did some research, we have direct SIP, or SIP trunking is what Cisco is known to Cisco. Remote call control, cookie link. So as we looked at the options, remote call control is more of a legacy option, and it's not really being recommended, so we didn't even look at that. Cookie link was something that had the potential, but as we looked more into it, cookie link is a client-based deployment, and we all know when we start getting into the client-based deployments with plugins and those sort of things, it can get a little messy and frustrating for the users and may not always be reliable. So we ended up taking the approach of using direct SIP, integrating our Lync mediation directly into our Cisco call manager through direct SIP. This is going to allow for some, a couple of different options. Number one, we can maybe look at the SIP URI dialing feature. We've done a little bit of testing, in regards to the Cisco environment, that if a user picks up their Cisco or whatever device a user that actually calls into the Cisco environment to a user's telephone number. We can, from the Cisco side, leverage the SIP URI dial-in. What this will do, it will dial that Cisco phone, but it will also look at the SIP URI address, and then it will forward over to the Lync environment to also dual ring their Lync client at the same time to allow the user to pick that call up on either the Cisco phone or their Lync client. There's also the option, it'll allow us to fully use the enterprise voice by doing the SIP integration, so it's going to allow us to use all those features. One of the downfalls is we're going to have to set up dial plans most likely in both places, and we're going to have to manage those dial plans in both places. But that's something we could probably manage, as we move forward. And it's also going to allow for migration path. I think as we grow with enterprise voice, we probably want to provide it to our IS group first, and we'd probably see more of those users wanting to adopt the soft phone without even wanting that desk phone. So as we move forward, we'll probably see more adoption of maybe just the soft client, so we won't need that dual ring and those sort of things in place. But these are things that we're looking at for the integration. We have the integration in place. We just need to do some more testing and configurations to get that working optimal for the users as we start moving forward with that. And the last one is the ability to leverage Lync Client as a soft phone. As we move forward with unified communications, it's going to be vital to be able to provide one-point access to use all of the communication tools. The last thing a user wants is several different tools to do all these different things. The easier we can put the tools in front of the users, the more efficient they're going to be to do what they need to do, and create that more efficient environment as we do move forward. Dial-in conferencing. So as we discussed, we're also leveraging that SIP trunk into Cisco, and right now our dial-in conferencing is coming from our Cisco environment for the Lync web users that we're testing that on. One of the biggest cost savings I've heard and read for Lync is the actual web conference, dial-in conference in itself, and that's been enough to justify a full deployment of Lync because of those savings alone. So we should see a lot of cost savings here. One of the great things with the dial-in conferencing and the SIP integration with Cisco is now we're able to manage and route those calls internally. So right now, because we have a third-party dial-in conference bridge, all of those calls are hitting the PSTN and going out externally. Once we do that integration fully, we're going to be able to route those calls, and they're not even going to hit an external PSTN connection because we're going to route it through Cisco, or if we bring in another SIP, and we're going to route it directly to the mediation servers. So now we're saving those external PSTN connections as well. And the integration within conferencing, those of you who are using the integration with the dial-in conferencing is just so much nicer. The ability to now manage the actual users and mute individual users. Now I can record one session instead of having an audio session being recorded through my third party and having to record my visual through Lync. So there's some, the integration is a significant improvement.
Have you considered putting a session border controller?
Yeah, so we've had some discussions. And we had some good discussions with our network engineers, and he believes we could probably do what a session border control can do through our routers at a router level. There's some other features. These are discussions we're having, so we need to really look at what. I know there's additional reporting and sort of things in the session border control, but we need to have those discussions to decide, because we are looking to bring in a SIP directly as well, and then we have the flexibility. Do we use the SIP integration directly, or do we bring the SIP into Cisco, since that manages the voice, and manage everything through there, but then we have some additional point of failure. But we have been looking at that, and we've got a lot more conversations before we get to the actual solidified platform moving forward. Next, our integration with AV. Our current AV platform, we have the legacy Tandberg, which is Cisco, and along with the Crestron systems in our environment. As we're moving forward, we're looking for ways to integrate our Lync environment with our traditional AV platform. 2010 allowed that integration to our Tandberg, but when we went to 2013, there was no supported integration until VCS 8 was released, which has just been released a month or two ago. So that's going to allow us to add the VCS platform. That's going to allow us to upgrade to VCS 8 and then add our Tandberg endpoints as a trusted application into Lync. So we're going to do some testing on that, but we're also excited based on the announcements that Lync is also going to support it from the Lync side. So Hopefully we can see that in the next few months, that we might be able to just bring it in onto the Lync side as an endpoint instead of going through the VCS. But we'll look at those opportunities too, and at least we have them available now to see how we can provide that integration to our conference rooms and the legacy systems over there. With those integrations, you're basically going to get a Lync client now as an endpoint within the conference room. Traditionally, those conference rooms, you would have to be physically in the room to be part of those, audio, video sessions. Now, as we look at those integrations, we can now have a Lync client be part of that, no matter where they are, and join those meetings. So that's a huge step in the right direction. And the next one is Crestron. Crestron's RL solution. I don't know if you've been able to check it out, but it's a pretty impressive solution. It's a new AV solution that integrates directly into Lync. Like I mentioned earlier, this is going to change the traditional conference rooms moving forward. A solution that directly integrates with Lync, and those of you who have seen or used this, it's just simply ease of use. We have in our environment, especially with executives, C-levels, when they have a audio video in a conference room, they pretty much require somebody to be there on standby to help them because of the complexity and the issues, and it's just not easy to use sometimes. So as we move forward with these solutions, the ease of use that's built in is going to make a big difference as we move forward in the conference rooms. And the next one is they're truly becoming a lot more affordable to put these solutions in place in the audio video conference rooms. So as we move forward, I'm going to go through initiatives that we've either have in place or we're actually working on right now, with all the different areas. The first one is video. So as we moved to Lync 2013, one of the biggest push was the high definition, the standard protocol as we move forward. So with H.264, we're able to start driving more desktop video now. We have a lot of executives that would need to book a conference room to do some one-way video with somebody at a different facility, and now with high definition video, we can now start driving maybe desktop video more for those executives. It'll be a lot easier to use. The quality is going to be there. And as we are growing with Lync 2013, we're slowly getting a lot more requests for video. Video is just becoming the big thing, with the platform as we move forward, and everybody wants to start using it. And mobility. The 2013 mobility client creates a lot more opportunities. Those of you who are using it right now, there's a lot more you can do with the 2013 client, and also the ability to actually have high definition video as well through the mobile client is a big one over 3G. Again, we're not going to maybe provide that full 1080p over 3G depending on the service, but it is available and it's there right now. Integration with Hamburg, like I mentioned earlier, VCS 8's just been released, so now we can start doing some of those integrations into Lync, into our legacy systems. Lync is an endpoint in the conference rooms, and again, you're not required to physically be in the conference rooms. Considerations, I just wanted to add this in here. Those of you who maybe haven't looked at this, but call admission control and QoS. You need to either look at this if you're not looking at this, and you need to get in this in place pretty fast. So we do have our QoS. We're actually just finishing off our CAC, configurations and getting that set up right now. But these are going to be huge when you move forward to audio video with Lync to make sure you're managing that traffic, and that essentially you're not going to affect other traffic. For us, our physician traffic is most important, and that needs to be the primary communication that always happens. And then when we have our audio video, we can now downstream it to make sure that traffic is the primary traffic going to the facilities themselves. Like I mentioned, 4 meg stream. If you're doing a true high definition in Lync 2013, you could be using up to 4 megs of bandwidth. Some of the benefits with video, the current video solution has already created significant savings. So when I reference our current video solution, that's our AV guy leveraging the Tandberg Cisco side of it, and he's been able to drive a lot more audio video instead of having people travel to the site. So he's generated a lot of savings through the audio video, but as we move forward, we're going to start being able to leverage Lync as part of those savings and start driving more desktop video as well for the user. So we're going to see potentially a lot more savings as we move forward. And the scalability with video without needing support. As we move forward, we're not going to have to require, hopefully, a technician to always be available in these conference rooms. You know, I'm sure we all have other areas we could get more productivity out of those techs rather than them standing in a room for an hour to support an executive. And again, you know, one of the benefits is the more affordable video solutions, the conferencing solutions as we move forward. And then we look at voice. Currently, we're a Cisco. Our Cisco deployment is still moving off Nortel, so we have a mixture of Cisco and Nortel in our environment. Like I mentioned, we have large investments that are already being made. We can't just displace those overnight, so we do have to continue to use those. We have, like I mentioned, direct SIP into Cisco Unified Call Manager 9. We're at version 9 right now. Not all of our sites are, but our integration with Lync is at our Call Manager 9 in our solution center, which is our building. We're also currently leveraging dial-in conferencing, and our SIP integration will allow us to create enterprise voice initiatives as we move forward. So now we can bring in that enterprise voice into Lync by creating that SIP integration into our Cisco environment. Next one is SIP. You know, SIP's been around a while, but I think it's becoming a lot more adopted, as we're seeing. It's definitely more of a trend right now. You know, as we look at SIP in the traditional voice network, and if we look at maybe 5-10 years ago, where we could probably have seen maybe 4 different networks and environments. We have, you know, what could have been an AV network. We have our voice networks. We have our traditional IP networks, and then we could possibly have a security network. I think the trend has been to slowly bring everything over to IP now. And as we look at AVs, pretty much already on there, the security networks are already IP-based. But the next one is bringing, you know, the voice network into SIP and making it IP-based. You know, there's arguments against that. You know, some people like to be very conservative, and you know, the fact that putting all your eggs in one basket. But if we look at moving forward with the network layer, is, you know, if you simply provide that capacity, but also make it redundant, then you don't need to worry about whether it's, you know, one of them is going to fail or not, because now we have everything at a redundant layer, but you're providing the capacity. So as we move forward with SIP, you know, especially in the voice world, there's going to be less physical limitations. You know, with the PRI, you make that 24th call, it's not going to go through. Now I need to provision additional hardware and everything else is a big cost. With SIP, we're now going to be able to be a lot more flexible and expand simply, you know, with essentially a call to the company and say, hey, I need to expand my SIP connections. Now I can go from, you know, 24 to 48, you know, with a phone call. So I think we're going to see a big growth, a big movement, especially in our organization. We're just getting there with it right now, and we're pretty excited to get there with SIP. And I think we're going to see some big cost savings and improve manageability as well as we move forward. Location information services, we're configuring LIS to display the location and city within Lync. We're not using it for E911, which is what LIS is essentially for in Lync, but we're actually going to leverage the display location city within Lync, because once we finalize our CAC setup, our CAC setup, based on the subnets and referencing those subnets to city and location, we're now going to be able to identify where users are within the organization through the location information services. So this will be a nice little addition, especially since we're so dispersed. If I'm traveling to a site and, you know, I log into one of our, you know, Illinois facilities, the users, you know, somebody back in our central site will at least know that I'm maybe traveling and I'm in one of our facilities in Illinois. So we're going to be leveraging this as well. It'll help, you know, identify where the users are within the environment, so it'll be a nice little feature. Again, considerations we discussed, you know, your QoS, call admission control, make sure you're taking that into consideration as you look at your Lync deployment, especially going to 2013. And obviously some of the benefits, you know, potential cost savings, integrated applications, and at the end of the day, we're all here for the customers and the users, and we have to be able to create that user experience. And as we move forward with these integrations, we should be providing a much better customer experience. So next with web conferencing, a little bit of history. I briefly touched on this earlier, but we migrated from Bell South conferencing. It was becoming end of life, so we looked at Lync. We had Lync 2010 in place, and we looked at Lync as an opportunity to start doing our web conferencing. So we got moved over to Lync 2010 for web conferencing. Again, like I mentioned, we supplemented the web conferencing, which we're still using today, with AT&T dial-in. So we have the 2 separate areas. Right now, we're using full conferencing in Lync 2013. supplementing with the AT&T with that. We have our direct SIP into our VIPE environment. We're testing that conferencing, and hopefully as we move forward, we're going to be able to hopefully displace that third-party dial-in conferencing. And as you can see, right now we're about $15,000 a month just on our dial-in conferencing alone. So there's a significant cost savings right there once we're able to get. Obviously, there's going to be cost in getting SIP in and getting that integration to happen, but based on the cost that we're paying right now, we're going to be able to create some significant cost savings, I believe, as we move forward. Like I mentioned, we just need to increase our capacity right now and finalize how we're actually going to bring that SIP in. We have it into Cisco, but we're also looking at bringing SIP in directly, and do we need session border controllers and those sort of things, depending on our environment size. So we're moving forward to try and finalize and architect all this as we move forward. Like I mentioned, we are working with Bright House to bring our first external SIP into the environment, so this is exciting for us to start moving in that direction. And eventually we'll get to the point where we can get everybody, hopefully, into that dial-in conferencing environment as we move forward. So some of the benefits, like I mentioned earlier, the ability to now route calls internally, that's going to be a big cost savings right there, because now we don't have to pay for all those external PSTN connections. The integration and ease of use is significant. The ability to, as we look at the web conferencing, is right now I have to dial from my cell phone or desk phone. As I move forward with the integrated web conferencing, I now have the flexibility of either calling in traditionally to the conference line, or I can pick up my headset, I can call from my Lync client using Lync audio, or I can maybe pull up my web meeting, I can go click to call my desk phone, call my cell phone, or I can even take it to the next level and start using the mobile app and call in from my mobile app if I'm leaving the office or doing whatever I need to, and take that call from there. So the integration and the unified, solution that we're providing is significant on what we're doing right now. So I also wanted to touch upon the RL system. So we one of the first customers. We have 2 of these deployments in pilot right now. As soon as Crestron released this, we were able to get our hands on a couple, and we have them in our environment, piloting them. The solutions from using them are, the ease of use is just incredible. It's bringing Lync from the desktop into the conference room. So now our users are essentially going from a familiar client on the desktop into a conference room, and simply with a click of a button, I've now just joined my Lync meeting within the conference room. The ease of use is there right now with these systems. It offers the full, complete collaboration within the system. It has a built-in whiteboard that supports H.264 with SVC that we discussed earlier, continuous presence and multi-party calls, complete Microsoft optimization, and it utilizes software that the customer already owns. This is big. We already have Lync as an investment, so let's do the integration, and now we can leverage our Lync environment into the conference rooms as well. And as we look at the Crestron Lync RL system, the low cost of ownership, we already have Lync licensing. We already have the servers in place. If you already have a Lync server, we don't need the MCUs or gateways, because we're leveraging the front-end servers for the MCU. Backwards compatible with existing video conference systems. This is where we need to do the integrations, and we'll probably need some form of third-party MCU to make that happen. But it's available. It uses unified communication industry standard protocols and codecs. It integrates seamlessly with existing rooms. No system design or program is required. It's dropped into the room and it's pretty much ready to go. You obviously need to set up your resource account in Exchange, get that configured, but once it's all set up and integrated, the system simply logs on. And then basically, as you see on the touch panel, it integrates with Exchange as a mailbox. So when I essentially set up a meeting, I go to my Outlook, I look for my rooms or resources. I find the room that the system's in, I add it to my meeting. When I get to my meeting appointment is going to be listed on the screen. When I see my appointment on the screen on the touch panel, I simply click that appointment. From there, it simply adds that as a resource to the meeting. Then everybody else who is either remote within the building is now part of that collaboration within the Crestron system itself. Limited user training required to operate. This is huge. The ease of use is what we're looking at, and when we look at the cost, the cost of this is going to be approximately 30% of our current room cost, so there's some significant cost savings right there as well. So obviously we're healthcare, organization, so I wanted to make sure we covered some healthcare initiatives that we're seeing in the organization right now. Some of the things that I've been working with the facilities, we have physician practice processes, so we have seen the adoption of IM and presence within some of our physician practice offices. What we're seeing is, a physician will be in with, or a doctor will be in with a patient. The patient will be finishing up, the doctor will be finishing up with the patient, brings up his computer, brings up IM and presence, and simply, IMs his nurse, who's assisting. Once he IMs the nurse, he says, hey, I'm finished with the patient, can you please come in and finish off? And once he's done that, he can now efficiently move on to the next patient. We've all been in, physician offices, and we know sometimes it gets a little frustrating when you're sitting there for 20 minutes and twiddling your thumbs, waiting for the physician. A simple IM is allowing them to become, more efficient and creating better workflows just within those physician offices themselves. So we're seeing the adoption of this right now within our facilities. Prescription approval, we're seeing some adoption of Lync video in a couple of our facilities, and the ability to do prescription approval through video. This allows true identification, and again, it's creating more efficiencies for the physicians to allow them to serve the patients, which is what they are essentially being paid to do. This one right now we're pretty excited about. It's not something that's in production, but this is something that we're working with our physicians in the Midwest region right now to see if this solution is actually going to, meet their needs. Stroke observation. We had some physicians come to us, and we're looking for opportunities to maybe try and do some form of video, observation with the patients. Because we had Lync 2013 in place, number one, we have the mobile aspect of it, so we have mobility, and number two, now we have the high definition built into it. So with that, we identified Lync 2013 as a possible opportunity to provide, the tool set for the physicians to do some form of stroke observation. And what this will allow a physician or a specialist who's at a facility, be able to simply pull up a tablet, a laptop, whatever it may be, but somebody in the remote field with a mobile device can now simply pull up a mobile device, pull up their video, and now do a video call with a physician or a specialist who can now observe that patient and identify if that patient is maybe having a stroke. And that essentially could be the difference between life or death when we look at stroke. So we're hoping we can work to get this in place and start moving with it, because it's definitely something that's going to benefit, our physicians and also the patients who we can help. And the next one's web conferencing. We're seeing a lot more adoption of the web conferencing. We're now able to provide, tool sets for the patients, not needing to have to travel all the time. So now they can actually serve a lot more centrally or primarily in their location and concentrate more on serving the patients instead of traveling. So we're seeing a bigger adoption of the web conferencing as we move forward as well. And again, there's significant cost savings because there's a lot less travel going on. And then there was just some other initiatives that we've working on. Human resources is a big one. They keep asking for Skype all the time because they want to do remote interviews, but we have Skype locked down. We don't allow that. We still don't have Skype video federation because we're waiting on that. But with the Lync 2013 web app, we're working with them right now to do video with human resources through Microsoft Lync and just using the Lync web app, because now it supports with a plugin full video between the two clients. So we are working with them on those opportunities. Again, as Skype becomes federated with video, I think we'll be able to maybe move over and start using the Skype portion of it, for human resources. Mobility, there's just new opportunities. The opportunities are endless with mobility right now. The new clients allowing this to happen. We've enabled all our users for mobility. And again, one of the big ones with mobility, in 2010 is we have executives, physicians traveling all the time, and their big thing was, I want to be able to view the content, and I can't do it, on my iPad, on whatever they have traveling. So, getting to Lync 2013, we can now provide, through the mobile client, the ability for physicians, for executives who travel a lot, to still be part of those meetings and do the collaboration, with that tool set. So that's a big one. SharePoint, I'm working with the web team right now, some pretty interesting workflows. Leveraging SharePoint as part of the workflows, leveraging Lync as part of those SharePoint workflows. For example, I'm working with one of the programmers right now to set up a workflow that will allow somebody to to request maybe an equipment request, whatever it may be. But once that equipment request goes in, SharePoint goes and looks at the approving manager, whoever it may be, and see if they're available. If the approving manager is available based on presence, they're now going to get an IM stating, hey, you just had an approval. Sorry, you just had an equipment request. You can go on and approve it based on the IM. The next great thing is that if that person's actually not available, what it'll do, it'll fail back to an email, and then it'll route an email to the user instead because they're not available through presence. So I'm working with the web team on that initiative right now. The pictures, this was a big initiative I took on about a year ago. We were seeing a lot of pictures crop up of favorite football teams, cartoon characters. It was getting pretty creative out there, but it didn't create that professional look for our environment. So we took a look at what we could maybe do to better manage this. So what we did do is, number one, we blocked off the policy in Lync to allow anybody to upload their pictures. We also took the ability to link it out somewhere, so we completely locked that down, and we actually forced it to a directory lookup, which is our Active Directory. So we changed the policy to use Active Directory, and we decided on Active Directory for a couple of reasons. Number one, it is our directory central source, and number two, several other technologies can now leverage Active Directory, from SharePoint to Exchange to Lync, and anything else that simply wants to use that thumbnail photo attribute can now leverage it within Active Directory. So what we did is we worked with our site first, with human resources, got all those pictures, imported them into Active Directory, and we actually, it's been very well received since we've actually done that. The professional look that we're now providing through IM, presence through that tool set is a lot more, professional than it was when we let it open for the users to use what they wanted. XMPP, we're working just on getting that integration right now, but it's a lot more simplified. It's simply a role of the edge service that you have to enable, configure with some certificate modifications, but once you get that in place, Federation's now set up with XMPP, whereas before you would have to set up that separate, gateway and everything to make that happen. So we're working on getting that in right now. And as we move on, let's go through some of the future initiatives that we're discussing right now, things that we're looking to do as we move forward. Voice and video. Lync is a soft phone. I'm big on providing one tool set for everything, and Lync has the ability to provide that soft phone by leveraging our current investment. It's something that we need to look to push, because now we're providing one tool set, on your desktop, and it's not even your desktop now. We're now providing that tool set on a mobile device, because once it's enabled, I can now do everything from that mobile device that I can do on a desktop by integrating everything into that one client. It creates a better user experience. We got to remember, we're here for the users, we're here for the customers, we're here to provide them a service, and the happier we can make our customers, we'll probably be around a little longer. So, I'm always big on user experience, ease of use. Our physicians and nurses don't need to really think about the technology that's provided to them. They just simply need to be able to use it, so then they can concentrate on what they do best, which is serving the patients in our environment. SIP URI dial-in, we're already testing this to be able to do the dual ring for those who still want to use the traditional phone. Once we do that integration, we can now start using the full features in Lync, and the SIM ring is a feature that allows Lync to manage forwarding calls as well, so that would be available to the users. And fax opportunities, we need to look to see how we can move forward with fax as well. Voicemail is currently decentralized. Integration with unified messaging and Exchange will allow us to centralize that. Voicemail will be available in the Lync client as well if we do that. And then we'll also see some significant cost savings, because we have a dispersed environment of voicemail servers throughout the environment. Video, bringing AV into Lync 2013 is an option. Skype with video creates new opportunities. Promoting mobile video, we need to start working on educating our users more on what the tools they do have available. We've made it available, but they still aren't fully aware of what all the tool set can do. So we do need to start working on promoting the tools we have available for communications. And again, significant cost savings with all the voice and video that we're looking to do. Web conferencing, so dial-in, as I've mentioned a couple of times, we've got a big push to get to dial-in for the enterprise, with the cost savings, the improved user experience, and again, looking for that true unified solution for the users. Mobility, it's available to all users. Again, we need to promote the usage of mobility on top of the audio video. It's going to create more efficiency and collaboration within the environment. And some of the things, we need to maybe start looking at our training groups to see, how we can maybe help them with the tool sets as well to maybe adopt Lync a bit more. There's opportunities for less travel as we grow with Lync. Moving to Office 365 is going to allow, for more users to utilize web conferencing. So what I mean there is we actually with our license change, we're now going to be able to enable approximately 20,000 more users for collaboration, which we were limited to right now. So now we're going to be able to provide more collaboration to more people within the workforce. So this is a significant improvement for us. And then as we look at Office 365, as we move forward with this, some of the initiatives that we can bring in from the Lync side into Office 365 is the ability to now archive everything into Exchange from Lync, all those conversations. That allows now for easier e-discovery in one place, to look for all that information. Our unified contact store, like I mentioned earlier, centrally bringing all those contacts into one place now. Right now we have Lync contacts, we have Outlook contacts, and you have to manage all these areas. Unified contact store is going to allow us to bring it all into one area. Again, less confusion and easier management, for us. High resolution photos, like I mentioned earlier, right now the resolution's 48 by 48 in Active Directory, and those of you who view that full screen picture on a 60-inch monitor, the quality isn't there right now. So as we move to 365 and using Exchange 2030, we're going to be able to start leveraging high definition photos within that environment. And then unified message and voicemail. This is one of the big ones I'd like to push with, is to get voicemail into the inbox, into Exchange. That allows for a lot more opportunities, the ability to simply manage all my voicemail in an inbox. And the additional features we also get with that is the Outlook voice access, the ability for me to call into my mailbox and simply cancel a meeting, or view the status of a meeting, or maybe send an update to a meeting, all from my mobile device is significant improvements on what we can do today with voicemail. And then healthcare, video conferencing, allowing patients to video conference with family. We had an instance, with somebody in the military who wanted to see their newborn, and we couldn't really provide that through our enterprise tool set. So our users, our technicians did help them with their personal tools to make that happen. But as we move forward with video conferencing, we're looking to maybe provide the technology into the patient's hands now in a managed environment, a secure environment. That's most important. But as we grow with the technology and Skype Federation, we're going to be able to provide these opportunities to the patients. And that also goes in with mobility. Unified communication cards to tablets maybe at the patient's beds. Now we have a tablet at the patient's bed that they can pick up. Because we've provisioned a resource account of some form, they may be able to now use that and now do some form of federation through Skype and video with those loved ones who maybe live out the country, out of state, wherever it may be. Telemedicine, we need to start looking at more telemedicine opportunities, allowing physicians not to have to travel as much and maybe get them engaged a bit more through the video in different facilities. Healthcare from home, we're seeing a lot of sort of initiatives out there, so we need to look to see how we can maybe help with that with the technology that we have. Easily engage remote specialists. And then some other ones, conference room opportunities within the facilities because of the new systems coming along. And then, eliminating multiple communication devices. As you go in the facilities, we'll see multiple devices being carried, by the physicians, nurses. We need to look to see if we can eliminate all those devices and maybe bring them into one device, and using the tool sets that we have available, possibly with Lync. There's some opportunities that we need to look at moving forward. We've got a few more minutes, but on to the last few slides, we should be done. So I just wanted to include a couple of slides on mobility. As I mentioned earlier, I'm sort of big on the mobility and how it's grown. So it's just a quick trend of mobility in our environment, and it's probably similar to everybody else out here. But 5-10 years ago, it was typically enterprise-driven, tool set. We would, you would buy the phone, you would provide the phone to the user, and you would provision email for them, and it was simple as that. We've then moved into what was sort of more of a sandboxed environment. We used good technology, and we had a lot of complaints. The usability wasn't there. It was not what the users wanted. So then we looked at the MDM approach, which we have right now for our iOS devices. But those of you who are messing and using with MDM probably realize that it's a difficult solution for BYOD. When we start looking and exploring in the Android world, we have multiple different hardware manufacturers from HTC, LG, Samsung, and so forth. And MDM doesn't work too well, especially in our environment where we need to be able to control and manage the attachments from email itself. We need to make sure that it's secure, and that when a user leaves, that when we remove the email, that we also remove those attachments as well, and they're not stored on the user's personal device. So with the Android, it's been very challenging because of all the hardware manufacturers. It's been difficult, and as we explore more opportunities, I believe virtualized work areas is what's going to sort of get us there in the BYOD space. The ability to virtualize, supply that technology, because it's not just scope to email anymore. It's the expectation is I want to be able to view my files, I want to access my intranets, I want to access, everything from my mobile device. So we got to look at secure ways to do this. And virtualized work areas, I believe, is one of the ways, because now we're going to the virtualization layer. We're not reliant upon hardware, but we can also provide that in a secure fashion as well. And also, when that user leaves, we're able to securely remove that virtualized work area and all the information that comes along with it. So with that, just quickly on mobility, it's now consumer-driven. I think we all know that. The consumer's driving our mobility. It's bigger than just email right now. Enterprises, in my opinion, we're trying to play catch-up with providing that information to the users, especially in a secure fashion. Mobility is growing faster than we can manage. Initiatives need to be created and driven in one direction. Again, departments need to be on the same page. We have our web team building apps and doing different things. Then we have, our messaging team, which is the team I manage, trying to provide, BYOD and other incentives. So we all need to really get together and start looking, at a more centralized solution in regards to sort of app deployment and those sort of things. Users are expecting everything to be available from their personal devices, and being in healthcare, security is obviously our biggest concern. And how do we make sure with personal devices that we still protect that information in the event a user leaves? So mobility with UC and Lync. Mobility is becoming a significant driver with unified communications. Lync 2013, along with other Microsoft technologies, are providing this capability. IM presence, web conferencing, voice and video messaging. And then I'm going to throw in the Office 365. The ability to now start using all those Office apps and securing data with the mobile piece is going to be a huge sort of shift and change as we move forward with mobility with Lync 2013 and Office 365 especially. So with that, I know I'm eating into over time right now, but I just had a few closing statements from all the content that we went through. Unified communications is the buzz term. It's been around a while, but it's, how do I move forward with unified communications? How do I bring the teams together and become more efficient? It's grown at an incredible pace. I love working in this field. I mean, I wake up tomorrow and something new is going on, and it's exciting. It excites me. The demand to do more with communications has grown. Video is allowing so many more opportunities, and the demand is just going up and up, and we need to be able to provide that securely and make sure that we can actually support providing, those different areas of communication. Again, management needs to fully understand unified communications as a whole. We had those different directors, last year, and if not everybody's on the same page, you're not going to be able to drive forward with unified communications very efficiently. A long-term strategy needs to be defined, and a roadmap for direction should be defined. It probably won't be the same roadmap or strategy that you had a year ago, but at least if you have something down and you have a direction to work with, it's definitely going to help you get to, essentially your end goal and provide that better solution with unified communications. Mobility, again, it's growing faster than we can manage. Don't exclude mobility from unified communications as a part of it now, so you need to build that in and plan how you want to provide that technology through the mobile devices. And again, how do I do that securely? Bring together the involved teams, and the opportunities for great user experience and efficiency are being provided with mobility especially. Organize early, work on bringing teams together. Unified communication strategy will not work with different directions. It's going to be frustrating for the users. They're not going to want to adopt the technology if they have several different platforms, and users will get frustrated with different solutions being provided to them. Integration is key for successful unified communications. Large investments have probably already been made, and use the integration as an option to do them, as a migration path in the future as well. Understand your customers, understand what their needs are, create solutions and workflows to help them, be more efficient in their job and always communicate work with the customers. And then, the business value that we've discussed, the savings with dial-in conference and with web conference and video will definitely be pretty significant as you grow. And with Lync 2013, it does create, from what we've experienced, a true unified communication experience. The opportunities are endless. We can be as creative as we would like with the technology right now. That's the great thing about where we are and the place we are, is we can create those opportunities and they're pretty much endless. And I'll just finish, with, let the technology speak for itself is sort of where we are. So with that, I apologize for going over time. Do we have any questions? Who was first? That was quick.
So, going back to your healthcare experience, one of the questions I had was, you had a slide up there that made a remark about providing authorization through video whenever you're from what I can understand, whenever you had someone using telemedicine to dial into the experience. What is your plans around that? I know that whenever we brought our telemedicine live on the Lync, we had to jump through a lot of hoops to get authorization and validation of the user or the client before we put the doctor in front of it. What is your
Yeah, so the stroke observation, if that's the one you're referring to.
It was above the stroke observation.
Or the video within the facilities, the
I guess my question
prescription approval.
Yeah, I guess my question is, how are you validating and able to meet regulations, federal regulations, and proving who they are?
Those are good questions. We work with our DSO office, our data security office, to make sure that when we provide the technologies that they actually are comfortable with what we deploy. So that was presented to them, and their questions are always, is the information secure? The encryption between the videos, what's happening, and
I guess my question is, so I'm a user and I want
yeah.
to dial in and talk to a doctor. How do you know
So that piece, we're not at that level right now.
Okay.
We're not at a level where we have a user just dialing into a doctor. It's more of internal processes. Yeah. Yeah, so the process, yeah. So that process specifically is an internal nurse being able to sort of get that approval from the physicians within the facilities. It's an internal approval process using the video to do that right now. So, yeah.
So, go ahead.
No, go ahead, I'll answer my question. In terms of your existing clinical communication systems outside of your system, like environment, can you tell us what your strategy is?
So we use Cerner for all electronic medical records, and Cerner's driving some other initiatives right now, I believe, with the apps. So she's asking outside of our Cisco in regards to the clinical environment, how we're looking at the.
Yeah, and he's right. We use the Cerner system for EMR, and unfortunately, what that means is we get to influence them somewhat on what they're going to be building, but because it's electronic medical record, it really comes down to our partnership with them. And unfortunately, they're building that platform for mobile mobility, and which will then tie into having a mobile device that I can do part of the patient ID. I can do alerts to the device. I can get my schedule there. I can have my phone calls come to it. So all those things are being built for that, but it's going to be very purpose-built.
What time frame do you look at that?
Well, they would tell you it's ready now. We would tell you it's going to be about another 6 months to almost a year before it's really ready to be used.
Yeah.
Okay. So I have, how far along are you on your stroke services? I mean, are you guys actually?
So
Are you still in discussions about it, or?
So
we've,
the hospital,
yeah, so 2 different areas. Yeah.
It's been there for about the last year. The difference is we're now looking to move it to Lync because of the high definition.
Yeah.
We were using an existing video conferencing system. We would wheel a card into the ED room. They have a physician up on their side.
Yeah.
So how do you guys deal with your audio issues? Because one of the things with stroke symptoms is how well they can talk, right?
Right.
And when you have audio systems in the patient room, a lot of noises going on, stuff like that. Did you guys have to do any sort of special considerations for that audio, or everything you guys were right out of the box?
Well, we actually, on this one, because it was at the time, had some of those same kind of, we worked them a little bit up front on that, so it made it a little bit quicker for us to do that.
Yeah.
Did you have to add any additional echo connects on the end? We get a lot of bounce in our stroke office.
Obviously, we had to put in real good lights and stuff, but actually, it's been pretty good.
Yeah. And we,
That's why we're now looking to go to the Lync, because now we have
Yeah.
the quality of the video. Obviously, we'll look to use the same types of, that's one of our big concerns, is making sure we get the right mic systems in place, et cetera.
and the initiative in our Midwest region, we're actually just in the discussions, and we have a meeting set up next week that we can get everybody on to make sure we can get everything in place. We got to make sure we get with the network guys on the wireless and everything's provisioned correctly. So that's the Florida hospital looking to get to 2030, and this is a first-time initiative in the Midwest region that we're actually looking at all those things right now. Yeah.
Do you guys have other questions? Because I can do the next 20 minutes asking questions.
We can take it outside if you want to have some more conversations. I'd be happy to.
Are your positions typically employed, or for Tampa General, most of our positions aren't employed, so we don't license them for Lync, correct?
Most of them are not employed.
Yeah.
Okay. Could you purchase additional licenses for?
Can you get your own shop there?
Well, how do we get around it? We're not buying anything for them, we're just letting them use the service. This is just part of our internal system, when you're like, so like, for instance, Florida Hospital also uses it for OB, for instance. Patients out there, they're at their physician's office, they go, hey, we think this person needs to go to a specialist. We have specialists on call, and what it is kind of go into them in a Lync conference. And the physician office doesn't actually have to own a Lync license to be their invited guest.
Do you guys actually use the specialist on-call service or
Special what?
specialist on-call service, or is it just
No, it's our own internal specialist.
Are you using Scout right now at all?
No, we didn't provision the audio yet because we're waiting for the video. I'll probably get it provisioned in the next sort of few weeks. I'm just making sure everything meets the data security office requirements, in regards to manageability and security with that traffic. But we have it blocked completely, the network, and we do get requests daily. So we will probably get a provision for the audio ready for when the video is released.
What are you going to do with the text that you got? Are you counting that as your PHI and PII? Are you going to count that?
Yeah, we will.
So are you going to store those records in the server, or what are you going to do?
We just have to document it, so we probably won't. We'll probably say that they're going to get it. Because what we say, so like for instance, secure texting, we turn on secure texting, we've been very clear with, in our policies and stuff, if there's something that needs to be in the medical record, it's the nurse's responsibility to document it in the medical record. It's not going to be, we're not doing it with this texting system. Because here's the other thing, with the texting, secure texting, they can take pictures too. It might not be the same picture of the EMR, so we're very clear, if there's things that need to be documented in the EMR, it's their responsibility to either place the picture in there and or the text that they, write in there, spoke to physician so-and-so across secure text, they have approved us to move forward, blah, 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 blah.
So do you guys archive all your instant messages, or do you guys just archive everything?
We archive it through our Outlook. So basically, we're not doing it at a Lync level because we're going to wait till we get to the 2013. But anything that goes into Outlook, we're archiving through our current email archiving environment. Yeah. For email, we have multiple. Our general retention for email is 1 year. So everything up until 1 year, and then we have the option for users to request longer retention from 3, 5, 8, 10, all the way up to 15, I believe. But it has to be approved by a data security office, based on the business need.
15 is like legal.
Yeah.
Nature, maybe certain PFS things, things of that nature.
Yeah. That's, yeah.
They're spread out more than we are, but we suffer from rural areas, so we don't have connectivity to the net in many of the places. So what are you going to do in those cases? For instance, provide people the office on the computer?
Yeah.
Purely for cost.
Yeah. Excellent. Any other questions? I appreciate everybody's time. Thank you. Thank you.